So you don't, vaccinate a patient who comes in like very sick or likely to, close to death for something else. Those kinds of things, just don't do them. Those are the most egregious violations that some people talked about. Another one was, oddly enough, I collected from a healthcare worker, one of these healthcare workers whom I met independently through contacts in, neighborhood and perhaps I think I watched her in somebody's podcast. I can't remember which one. And perhaps I can, well, I'm not going to say the names of people because I don't know if they feel comfortable. But so she mentioned this person mentioned that they had seen, changes in the treatment of certain conditions that they would find in emergency care. For instance, a child with croup, and you have certain measures to implement when you find particular cases, but workers were saying, no, we won't approach this patient, or we won't do this because it involves contact, and reacting as if the patient were somehow, touched by the Black Plague or something like that. I mean, ridiculous. Even after they had gone through, we've been through, no vaccines, no COVID, no injections throughout 2020, people in the street, doing a lot of interventions in, emergency medical settings, et cetera, et cetera. But all of a sudden, you have a protocol that has been followed to even save people's lives, when not to at least, decrease their suffering, that were simply not followed due to the new COVID, prescriptions and policies. So she described some of these cases to my, health policy students. They're not necessarily future healthcare workers, but they will most likely involved in policy. So they're young people, second year, fourth year. So she described, these changes of protocol, for instance, how to treat a child in a distressed situation, completely different from what her 20 years of career had indicated so far.
Yes. Now, that raises another question, and I have to frame this one. We know that there was a great deal of neglect that happened in extended care centers because the workers were afraid to go near the patients. And we know, for example, that there were many hospitals that were in fact empty when media was telling people that they were full, and we've got the video evidence of that to prove it. But what we don't have, and possibly nobody but you has, because nobody but you has asked the healthcare workers, was there, at least initially, a level of fear there where they were afraid to approach the patients? Because you mentioned, a child recruit with cough, and they don't want to go near the kid because, maybe they're going to get COVID and die. Was that something that you perceive was happening early on in the narrative, that healthcare workers were afraid to treat patients?
If you ask me about the actual data I have observed so far in the 3 provinces, I have not seen that. I have seen more sort of generic accounts of, people were afraid, or there was a necessary fear. So people were so afraid they were reacting in fear, and fear is not a good advisor. So you react in fear, you do things that otherwise you wouldn't do, or you're given some time to think about it. So I did not find any healthcare worker who directly told us, either in writing or in person. But that actually raises a good point that I probably should include in the planned in-depth interviews that I plan to launch in the fall, once we wrap up the Alberta case, the Alberta survey, and we put together our reports. Now, I can give yourself, me as an example.